The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Every day, citizens around the country are faced with new dilemmas. Dilemmas that affect them profoundly. Whether it's injustice, discrimination, falling through the cracks, scandals and cronyism, balances of power, ethics, religious freedoms, state versus citizens, and unfunded mandates, and the list goes on and on and on. Welcome to Speak Up. It's directed at those who have fallen through the cracks, and it gives them a voice. It's your turn to speak up. To stand up and fight back.
Welcome to Speak Up. I'm Kevin Avard, your host, and today I am going to be talking a little bit about a press conference that happened in Concord today, and it has to do with the healthcare system and what it is doing, what it's not doing. And today my guest is former Senator Bob Clegg. Welcome to the show.
Thank you.
Thanks for coming on the show.
Appreciate you asking.
Now, you've been a senator in New Hampshire, state senator, for how many years?
Well, I was a senator for 6 years, and I was a House member for 8 years.
All right, so you're very familiar with the program up north.
Absolutely. I know how the sausage is made.
Right, and it's definitely sausage from what I understand. Well, we had a press conference today, and this is budget time. Everybody's working on the numbers. We actually got some numbers in, finally. We had a couple of budgets to look at. We had the governor's budget, and then we had the House budget, and then, of course, then we have the Senate budget, which seems to be the one that puts it all together. That's how the sausage is made.
The Senate's always the one to fix everything that's broken. Everybody else gets to pass it on knowing that they're not going to get the blame. The Senate knows it's going to get the blame, so it has to be a good budget by the time they're done.
Right, and Senator Forrester, she's doing a really good job at it. Senator Little, I say they're working very, very hard at this. So she was there at the press conference just observing what was going on. She was.
We had met with Senator Forrester, and she's very concerned about the care for the elderly at home and for the disabled. What we were meeting about was with the Elder Care Coalition, and they're all worried about the folks that are unable to take care of themselves totally, but are still good to stay home. And keeping them home is much better for them. They feel better about it. All they need is some help maybe for bathing and cleaning and that kind of thing. It's really simple. And the cost of that is much less than if they had to go to a nursing home. And a lot of them, if they didn't have this care, that's the only place they could go.
Right.
So what's happened is, as usual, the House sent over, the governor sent the budget to the House, and the House took it, and it's never got enough money to actually do what it's supposed to do. So what's happened now with the advent of the Accountable Care Act, the Health Care Act, now all of these people that have been taking care of folks at home now have to provide health insurance. Now, the Health and Human Services told the folks that provide that care to people at home that maybe what they ought to do is share employees so that no employee actually works for any healthcare company for more than 29 hours. That way they would have two jobs but never be qualified to have the state mandated health insurance.
So they're
telling everybody out there that this is what you have to do, but we as government are going to use all the tricks we can to stay out of it. Well, for a lot of people that doesn't work. And so what's happened is now the cost can no longer be borne by what the state's giving them. For instance, case managers are getting paid the same rates they got paid in 1988, and now they have to provide health care. One of the folks that I know actually takes money out of her pocket every single year. This is real money, not paper money, but real money out of her pocket to keep the company going because, as she says, if I don't do it, who's going to? But there comes a time when that can't be done. There was one letter that went out yesterday from a company that said, I can no longer do this. It breaks my heart. We'll provide other services, but if the state's not going to pay us, we can't do it. And there's going to be more. And that's just the beginning. And you have some folks, as I said, some folks are quadriplegics or what have you. They're young, they're bright, And there's one fellow that Granite State Independent Living assists in getting out of bed every day.
Now, they're located up in Concord, aren't they?
They're located in Concord. Yeah. But they do everything across the state. But they have folks that get you out of bed, and they put this one gentleman in his chair, and they get him to his computer, and he works for IBM every day. Now, somebody has to go home because he's obviously not able to get himself in bed. So somebody goes back there at night and helps him go to bed so he can get to sleep. But he's a real productive member of society. He just needs a little bit of help. He's not asking for a lot. He's asking for a little.
He doesn't need to be institutionalized. That's the whole theory behind gateways, too, from what I understand. Is you know, at one point we had all these institutions, and people were put into these institutions. You want to talk about the cost going up. I mean, that's 24-hour care, and so they developed gateways so that, you know, there can be some dignity with the people living at home.
Right.
Something very similar than what you're talking about.
We look at taking care of somebody at home costs roughly $35,000 a year. Sending them to the nursing home is about $100,000 a year. So from a fiscal point of view, which is better? It's obviously better. Plus, people would rather stay home, be active members in their community. There are some things they can still do. But if you can't get yourself out of bed, you can't help clean yourself up, there's only one place you can go, and that's to a full-time facility. So this group met today because what they wanted to know, what wanted everybody to know, is that the governor, Maggie Hassan, had put something out that said she found this surplus money that she was going to give to the nursing homes to keep them happy. Well, when these people saw that, they said, wait a minute, that's not surplus money. That's money, one, that you should be paying us, because you're not, the state of New Hampshire is not even paying them what the legislature in the last budget told them to pay them. They cut them back. They just don't care. GSIL, for instance, is getting paid at the 2004 rates. Now, inflation for him has been about 25%. Then add on the Accountable Care Act and the health insurance, which he pays for his people. He's not even close.
This is a disaster. This is a disaster.
And these guys are these are nonprofit agencies who truly, if you look at them, are nonprofit. They don't even pay their top dogs much.
You know, being a senator and sitting on Health and Human Services, it was my first day was like walking into a conversation that's been going on for quite some time. And sitting next to Senator Sanborn, we're given these dashboards. And all right, this is fine. And all of a sudden, I learned that we're $50 million in a hole before we even get started. And then, having talked with another senator, well, it's actually $75 million, Senator Everard. Oh. And then I talked to another senator, and well, you know, really it's 30 or 20 million. So there seems to be this juggling act, and there seems to be these cups going, and you really can't know at that particular time when you walk into your first day of a hearing, what is the level playing field? What is the truth, and how to get at it? And we don't even have the numbers.
Trying to get the truth out of the Health and Human Services is pretty difficult. When I was there, my 14 years, I was on finance in both the House and the Senate as a member of leadership, and I never got the truth out of them. The only time I would say that we came close to getting everything we wanted was when John Stephen was the commissioner, and he had come from the Department of Safety. That's a police atmosphere, so the truth was something he mandated that everybody give us. But now it's crazy. When I was in the House Finance Committee, Division 3, they were cutting something, and all of a sudden people came from Health and Human Services, and one lady said, oh, you can't cut that because that's $100,000 or something like that. And we said, wait a minute, they're only cutting 20. How can you be losing $100,000? I mean, they don't even tell the truth. They make it up as they go, and that's a problem because you can't figure it out unless you've been there for a long time. You know, I've been around the State House for 20 years now, so I pretty much know who's giving you a ration and who's actually being honest. And it's tough to listen to. Now, the dashboards, for instance, they're 2 months behind. There's no excuse for that. You either know what you have or you don't know what you have. And how can you run a department that large and not know whether you've got $100 million or $100?
And what does this actually mean to the people watching this? I mean, does it mean their taxes could go up exponentially?
Well, it means that taxes are going to go up. They're going to have to find money someplace. And if they don't, what happens when it's your mother and father? What happens if one of your children, God forbid?
Is there waste? Is there fraud?
I believe there's a lot of waste.
Mm-hmm.
When the balancing incentive program came in, that was $26 million from the federal government, and it was designed to balance the costs of home health care. And what the department did is they made this really nifty looking, beautiful website that told you all about it. and they printed up some really nice brochures. They did nothing for the people that needed the money. So they made themselves look good. They wasted a lot of money. They probably hired some friends and neighbors, but the people that the money was meant for never got any of it.
And again, that was what some of the press conference today was about.
That's what some of the press conference was about.
So,
it's time to stop moving the money to places that have nothing to do with the folks. We get the money from the federal government, and as you well know, I know you, that's our tax money. That's just not some free money coming in.
In order for people to it's really hard when you get up there and you start seeing all this shifting, and you're getting a lot of people throwing a lot of different figures at you. You really can get frustrated. Then you hear in the media, well, the governor rated the $7 million. What was that? The senior.
Yeah, it was the home health care.
Home health care fund. And then, of course, Senator Forrester said, no, that's not going to happen.
Right.
And now, all of a sudden, magically, it's going back. Somebody's playing.
Right.
And, as far as Senator Forrester, I got to tell you, I believe she's a straight shooter.
She's been working hard, I'll tell you. I've met with her a couple of times, and she's not afraid to ask the tough questions. And I think that she's doing the right thing. You're right.
But when that money gets put back, that's coming from someplace else now. And what they're saying it's not really so.
Right. Right. we don't know whether if they found $9 million just hanging around, then where else is their money? And that's what we always found when I was there. There's these little cracks and crevices where there's money. I used to say that the Health and Human Services had more mattresses where the money was kept either inside or underneath, because every time they wanted to buy something, they had the money.
We recently had, actually not recently, a few months back, Deb Shorter. She was on my show, and she actually worked a caseworker for Health and Human Services for, I don't know, it was 20 years, 30 years. She wrote a book called Ripping the Mask Off of Welfare Fraud. And she said that a lot of the fraud can be found in the area of disability. That's just grown exponentially, and they're just stealing. And we had a debate on the floor about the EBT cards, or EBT cards.
Yep.
And one of the things that we learned in committee, I said, hey, by the way, is there any fraud out there? Oh, there's only 2% fraud. Oh, apparently that's acceptable. But then I asked somebody else in the back, well, are we behind in some of the fraud cases in Health and Human Services? One of the workers said, yes, we're about 13 months behind, backlogged, and up to date, we've already discovered about $1 million worth of fraud. I thought that was rather light, but $1 million is $1 million. So do we say we need more caseworkers to find out where the fraud is?
We need more auditors.
Yeah.
We don't need them in the Department of Revenue. We need more auditors that belong to the legislature, so that you can take auditors and you can stick them in those areas where we think something's wrong. You talk about fraud in the EBT cards. When I was there, we put a plan together that said that you just can't come into the state of New Hampshire and suddenly expect that the state of New Hampshire is going to take care of you.
Right.
And you were supposed to live here for 5 years. But I know people who have come from New York and have lived here, and their parents became elderly, and the state of New York said, well, sell your brownstone and do this and do that. And the family didn't want to do that. So the family kept the brownstone. The mother and father came to the state of New Hampshire, visited their daughter, and at the end of the weekend, their daughter brought them to one of the local hospitals, dropped them off in the emergency room, said, not my problem. Father had Alzheimer's, severe Alzheimer's, and the mother wasn't doing so well either. So the state picked them up, put them in a little place where they could live together in housing, at a nursing home, basically, because he needed constant care. And then when he passed away, that's where she stayed. Now, they have assets. Do you think anybody in New Hampshire said anything? Asked them? No. No, they're just people here. We
so
don't
why
care.
would we absorb that? Does that generate money someplace else?
Well, we absorb it and we spend our money, but they're not New Hampshire residents. They're
Right.
from New York. New York said no. You know how many cases that I know of that are happening right now? 10. Because New Hampshire's an easy spot. Nobody cares. Nobody looks.
And the taxpayers are funding it, are
Right.
doing it. Now, the problem with that is then you see the people that actually need the money, and all of a sudden the funds dry up because people that aren't qualified for it or stealing from the system are taking from the people that actually need it.
And the people in New Hampshire are tough Yankees, no matter what people say. We're tough Yankees, and we wait till the last minute to ask for help. We don't just decide, okay, well, this will save my brownstone. We wait until we don't have any option, and then we
Right.
say to the state, can you help me out? It's killing us.
We saw a ton of emails. Don't get rid of my disability development. Don't get rid of the disability. Keep it in there. Keep it in there. And of course, we have a number of people that I have some neighbors that need it.
Yeah.
They actually need it. And I said, I promise, I'm going to go look into this. And Senator Forrester, you're right, Kevin. We're not going to. This isn't something we're going to move, because that's our obligation to the people that actually need it.
Yeah.
It's the people that are stealing. But there's a lot of misinformation that's put out there. Oh, well, the Senate's going to, or the House is stealing from this fund, or they're stealing from this fund. How can the average taxpayer or viewer find out what's really going on?
I think what people have to do, number one, is during elections, they need to start asking people questions. And during the budgets, they need to pay attention, read the newspapers. You can read them online now. Follow it closely. And sorry, but call your senator and call your house member and say, what are you doing and why? Make them explain it to you. The ones who won't explain it to you, remember that, because the next election that comes along, that's a great thing about this. It's every 2 years. Don't vote for them.
Right.
Send them home.
And generally, I'm just going to talk on that particular topic. If I don't know, I always know where I can find the answer.
Right.
And we had a lady in my office today. It had nothing to do with the budget. It had something to do with family courts. And so I don't know. Let me get you in touch with Amanda, or let me get you in touch with this person.
Right.
Sometimes that's the best we can do. But if you're being ignored, that's a problem.
If you're not getting your phone calls returned and nobody wants to bother to tell you, then there's something wrong. And it's my opinion that somebody should say, there's nothing wrong with saying, I don't know.
Right.
Some people don't like that. I encourage people to go to the barbecues and what have you. Yeah, they're fundraisers for people who are running for the next election, but go, because you know what? Sometimes for $10 and a hamburger, you can find out an awful lot about somebody. And that's what they need to do.
So what are we going to accomplish with this press conference? Who are we going to try to motivate?
Well, you know what? The motivation was aimed directly at the governor. Governor, you found $9 million that you really didn't find. So now if you have $9 million and it's in the health care account, we think that what you ought to do is pay the people at the rates that the legislature determined in the last budget that they were entitled to. So give companies like GSIL what they need. You know, for $2 million in the next budget, GSIL can continue to service all of these people and still comply with the law and not play that game of, well, ignore the law, do whatever you can not to give your employees their health care. He can do it, and he's one of the few that has such a large clientele. But the others all need help.
Right.
And you know, the other problem we have is the managed care organizations. I didn't want to skip that. The managed care organizations came in and they told us that they would reduce our Medicaid costs by at least 12%, and they would put that 12% in their pocket. And we all laughed because we knew how cheap the state of New Hampshire was, and we were downright frugal. And so they came in, and there was 3 companies, and one company realized, I can't make any money in the state of New Hampshire, so they left. Well, in order for New Hampshire to be qualified to take any federal funds, we have to have at least 2. So what ended up happening was we had 2, and one of them said, you know what, I'm not making any money in here. So all of the people that used to do all of the Medicaid work that should be done by the managed care organizations are still being hired or still being employed by Health and Human Services. And the reason being is in order to keep that second company here so we would qualify for federal funds, we said, we'll take over some of what you're doing. Now, this isn't the first time. We did the same thing with Healthy Kids when that was here. We had all of state workers working on a quasi-governmental agency, but when we tried to take the $3 million that were in their bank account and use it for kids' health, we were told it's not ours to take. So here you have the managed care organizations, or the MCOs, doing pretty much the same thing. Now, I found out one thing that was extremely disturbing. Back when John Stephen was commissioner, we decided to buy our drugs through a consortium of states. And there are all kinds of rebates that come back, and the more you buy, and everybody shares in all the rebates based on what you use. And we saved a substantial amount of money by buying direct through the pharmacies, through the companies. Well, the state of New Hampshire, in this budget, the governor sent it down. What's going to happen is we're now going to pull ourselves out of the state consortium, and we're going to let the managed care organizations buy our drugs for us. Now, why in the world we would ever do that? Because I asked, and the reason being really...
This is through the executive branch?
This is through the executive branch, but it's in the budget. So you guys have a chance to stop it. But the managed care organizations are going to buy the drugs for us. They're going to keep a portion of that
Savings.
Rebates and savings. You know, I call them kickbacks because that's what they are. And I'm having a hard time when you show not saying that word, but I have to. They're going to keep some of those kickbacks from the pharmaceutical companies. We also don't know what their formulary is going to be. We've got a formulary, drugs that we've agreed with doctors are essential to keep people healthy. That may not be what the MCO is buying, the managed care organization. So we may end up having people who get sick who now have to fight. So now it's going to be more costly for doctors to go and fight and say, no, my patient has to have this, he can't have that. And we're going to lose some of the savings. Worst part of that is if the MCO decides, you know what, I'm still not making enough money in New Hampshire, and they walk away, where are we going to buy our drugs? Is the old consortium going to allow us back in just because they're nice guys? Or are they going to say, you left, take a hike? So we're putting ourselves in this precarious position because managed care organizations aren't working. We didn't need it in the state of New Hampshire. Now, I'm a big fan of saying if our workers, our employees at Health and Human Services were doing it and doing it so well that a private company can't come in and make any money, why do we want to get rid of them? Isn't that the kind of employees we want? Mm-hmm. And so by the time the budget goes through and that happens, we're all going to be sitting there saying, I knew it, and now how do we fix it?
And everybody's going to be pointing the fingers.
Everybody's going to be pointing the fingers, but let's face it, no offense, I was a senator. Senate was the last one with their fingers on the budget, so it's always our fault.
Well, we're going to be trying to fix it. We got some good people on it. And,
you do.
But sometimes you're handed a mess.
And sometimes you can't fix it because you don't know what's there.
Right. Well, I appreciate you coming on the show to talk about this. It was important, and I'd like to have you come on again in the future to talk about some other issues, if at all possible. I know we have other issues with Health and Human Services, such as the vaccine registry. A lot of fingers on that.
There's a lot of fingers everywhere. There's a lot of fingers on how they're going to treat people. I know I was part of a system where we brought in 160 people through phone calls, and when they found out that everybody hated what they were doing, they told the federal government that they didn't have anybody complain, and instead of calling all the public hearings, which is what we attended, public hearings, they called them forums and just ignored us. So
that's your government working for you. So contact your senator.
Contact your senator. Start with Senator Avon.
Yeah, I'm working on it, and that's why we had you on the show.
Listen, Kevin, you're one of the good guys, and people should know he is one of the good guys. He does his work, he does his homework, and he fights for the little guy back home. Oh,
we try. Well, until next week. Thanks for watching Speak Up, and we hope that this information is helpful to you. If you have any questions, just contact us at speakupnh@gmail.com or accessnashua@gmail.com as well. There you go, guys. Until next week. See you. Thank you for watching Speak Up, and we want to thank our sponsor, Aardvark Cleaning. If you have a carpet job, call Aardvark. They're the best in town. And if you have a story and you want to be heard, contact me, Kevin Avard, at speakupnh@gmail.com. That's speakupnh@gmail.com. We'll get your voice heard. Thanks for watching. Until next week.
Every day, citizens around the country are faced with new dilemmas that affect them profoundly. Whether it's injustice, discrimination, falling through the cracks, scandals and cronyism, balances of power, ethics, religious freedoms, state versus citizens, and unfunded mandates, and the list goes on and on and on. Welcome to Speak Up. It's directed at those who have fallen through the cracks, and it gives them a voice. It's your turn to speak up. To stand up and fight back.
preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.